Hi, welcome to the Watch and Whisper channel where I talk about things that are interesting to me. If I find it interesting, I'm going to talk about it. Well, what I'm going to talk about today is a series that I found on the Peacock channel named Dr. Death. It's an 8-part series and it is about Dr. Christopher Dunce, who is a neurosurgeon in the Dallas area who actually had to stand trial for elder abuse. However, the series takes you through like 2009 to 2017, but it focuses on surgeries that he performed on patients, and he did not do a good job doing these surgeries. And for lack of a better term, he butchered his patients, and unfortunately, some of his patients died. But I found it very interesting. The very first episode focused on introducing the characters that were in the series. The first character we were introduced to was Mrs. Bear. I want you to remember her name, Mrs. Bear, because she's going to play an integral part later on throughout the series. But we were introduced to Mrs. Bear. She was one of the patients that was seen and actually had surgery performed on her by Dr. Duntz. After that, we were introduced to Dr. Henderson, who was also a neurosurgeon. Dr. Henderson was introduced because he had to do, I'm assuming, some type of revision surgery that Dr. Christopher Duntz had performed on Miss Bear. So he had a very good bedside manner, but you could tell that he's going to come across as a very caring physician, and he wants to do the right thing by all of his patients. After that, you're going to be introduced to Dr. Kirby. Now, Dr. Kirby is a vascular surgeon. Dr. Kirby is very outgoing. He kind of flip at the mouth, but you can tell he genuinely cares about his patients. So Dr. Kirby had an interaction with Dr. Duntz prior, because they were in the same operating room. I think it was when Dr. Duntz worked at Baylor, where Dr. Kirby is a vascular surgeon. Well, they had words in the operating room, and from that you can tell that's going to set the tone for those two throughout the rest of the series. Now, again, Dr. Kirby is very outgoing, but he likes his patients and he wants to make sure that his patients get the best care possible. Now, the next person that we're going to meet in the episode was Dr. Christopher Duntz himself. Dr. Duntz was actually outside one of his clinics, and he was waiting for two patients that were coming in. Well, actually, a patient and a husband. Well, he talked to the patients. He was very charismatic. He answered the questions that she had. He was very believable in everything that he told her, and he was pretty much just getting her ready to prep for her upcoming surgery. Well, after that, the next person that you're going to meet is Josh. No, the hospital administrator. She comes in while Dr. Kirby is actually performing surgery and asks Dr. Kirby what did he know about Dr. Duntz. And he didn't have anything good to say. He pretty much told her he's garbage. And he said, wait a minute, what did you do? And so that's when the administrator said, well, we've already hired him. And he was like, oh, you can look on his face and tell he just was disappointed that the hospital decided to hire Dr. Duntz. And in a joking way, he said, you should have came to me first. You know, I'm well connected. I'm like the big man in town. I could have told you about Dr. Duntz. Well, it was too late. It was already done. They had already hired Dr. Duntz. So after that, you meet Josh, who is a circulator nurse. Now, I don't really know what a circulator nurse is, but Josh was the circulator nurse. That's what they called him. And he was going to be in the operating room with Dr. Duntz. Josh and Dr. Duntz, their interaction, you could tell right then it's going to be something with those two. Now, Josh came across like he really cared about what was going on in the operating room. He wanted to do a good job. He wanted to have a certain level of professionalism. Well, he was in the room talking to another patient that was getting ready to have surgery with Dr. Duntz. Dr. Duntz walked in, started talking to her. So Josh backed up. But Josh could see that Dr. Duntz had a hole in his pants. And, he discreetly got in his ear and said, hey, doctor, you have a hole in your scrubs. The doctor flipped, turned around and told Josh pretty much, I'm the doctor, you're the nurse, go get my room ready for this surgery. Josh was like, okay. He backed out, went where he was supposed to go. After that, they cut to a scene where they're in the operating room with Josh and other clinicians and Dr. Duntz performing surgery, but the surgery is going on longer than it should, which was a red flag for everybody in the room. And you could tell that Dr. Duntz looked like he was kind of struggling, whatever he was doing with this particular surgery. Now, Dr. Duntz is also a neurosurgeon like Dr. Henderson. I forgot to mention that at the beginning. Well, next scene that is going to cut to is Josh walking down the hall, and that same administrator who talked to Dr. Kirby stopped Josh and just kind of asked, hey, how did that surgery go? And he was honest. He said, hey, it went a little long. And she was like, a little long? It shouldn't have taken long. And Josh went on to explain a little bit why it took long. So that was a red flag for her. So that was concerning. Well, the next scene, it cuts to um, Dr. Dunce's father coming to see him. Well, the dynamics between the son and the dad was kind of interesting. The father, you can tell, is a Christian man because he talks about his faith a lot, and I think that's what Josh knows how to jab at his dad. He knows how to get under his dad's skin because he was cursing a lot, being very arrogant, and just not what we would consider maybe being respectful to his dad. And his dad kept calling him out on his stuff. Well, he didn't like the fact that the dad just didn't go along with what he was doing or what he was saying. And he pretty much left the dad at his house because the dad came to his house because the dad lives in, I think, Colorado. But the dad came to visit because Josh called. Not Josh, I'm sorry, Dunce called. I think he called just to be calling. But the dad took that as, hey, my son need me. Let me just make a quick trip to Dallas and go see what's going on. So the next scene, it cuts to Dr. Duntz riding down the street, scrolling through his phone, and he looks at a house, and then he kind of drives off. Well, they cut back to a conversation he was having with the husband and the wife in the office, and the wife asks, where is Kim? So keep in mind the name Kim, because that's going to come up a lot, and that's going to play an integral part in all of the series, all of the episodes going forward. When she asks, where is Kim? It's kind of out of the blue. Nobody knows who Kim is because this is the first episode. We hadn't seen anybody named Kim. Well, he said Kim was wherever she was. But it cuts to a lady in a house where she's making her, I'm assuming her dinner, her snack or whatever. And she goes to sit down to watch TV. But she looks out the window. She notices this car. She storms out of her house, goes to this car. And she said, hey, get off my street. Well, this was strange because this person just comes out of nowhere. She hadn't been introduced as an integral part in these surgeries that were taking place at the hospital. But when she starts telling him, get off my street, and he calls her Kim, I'm like, okay. So somehow Kim has something to do with this hospital, with his clinic, and the patients actually know her. Kim told him that she had already filed a restraining order on him, and if he came back, he was going to go to jail. That too was interesting because if she worked for him, and this is all happening on the first episode, if she worked for him, how is it now she has a restraining order on him and all she had to do is make a phone call and he's going to jail? So I found that very interesting about this dynamic between Kim, and her name is Kim Morgan. So keep the Morgan part in mind too as the episodes go on. I've watched all the episodes and this is just episode 1. And so if you like medical dramas, if you like Law and Order and all those type of legal shows, you're going to like this one because it has every element: medical, legal, the family dynamic, just surgeries, if you like those bot shows and all of this is going to come together in this one episode. But this is just the first episode, and I'm telling you, you are not going to be disappointed if you go on and watch Dr. Death on the Peacock channel. It had me from the beginning to the end. I'm just going to look over my notes really quick. I don't think I missed anything else. Again, just keep in mind Miss Bear, she's going to play an integral part. Dr. Kirby, Dr. Kirby, and also Dr. Henderson, huge roles. And keep in mind that hole in the scrubs. That's going to come back up, but that is going to play a big part in everything too. The hole in the scrubs on Dr. Duntz. So that's all I'm going to talk about this episode. I'm going to come back. We're going to talk about episode 2. But I'm telling you, go out and check out Dr. Death on the Peacock channel. And if you've seen it already, drop down in my comments. Let me know what you think about it. If you haven't and you decide to watch it after you watch this, drop down in my comments and just let me know what you think about it. All right. Hope you've enjoyed this installment of Dr. Death. I'm going to do 8 parts. This is just the first. I think you're going to enjoy it. Have a good night. Bye, London. Bye, Bam.